This is Talk Business and Politics with Roby Brock.
And welcome to the program. Glad to have you with us. Healthcare in Arkansas is about to take a new spotlight as a task force of lawmakers prepare for months' worth of meetings to end the private option and derive a new approach. Joining me to talk business, politics, and policy is Greg Bledsoe, the state's new Surgeon General. Welcome to the program.
Thank you, Roby.
Welcome back to Arkansas.
Yeah.
There you go. Tell me what drew you back to Arkansas for this particular job. You were out of state, you were doing what, and then you decided this opportunity existed.
Well, I grew up in Arkansas. I did med school and residency here, and left the state in 2002 after my residency so I could go to Johns Hopkins and get some further training, was on faculty there. But I've done a variety of different things, but I got a call from the governor soon after the election and was really excited to come home. When I look at opportunities, when I'm evaluating job transitions, I always ask, what will I be doing and who will I be working with? And the opportunity to come back to Arkansas, where we've been doing a lot of healthcare initiatives that are really innovative and leading really the nation in what we've been doing, and to work with someone the quality of our governor, who's an experienced executive and a great individual, it's just really exciting. So I jumped at the opportunity to come home.
Give me a little insight as to what your philosophy is going to be to all this innovation and change and, quite frankly, turmoil and chaos at times that we've been in, and I believe we're about to go through another phase of.
Well, I think it's going to be a lively discussion going forward, but as far as my philosophy, I just don't want to sit and rest on what we've done. We want to continue to move the ball down the field, so to speak. I mean, in Arkansas, we lead, and we want to move forward. We want to take the next step for reform, and we certainly want to push innovation forward in Arkansas with regards to healthcare. So that's what we're going to try to do.
Let me run through some of the latest statistics that we've got on the private option. Obviously, the marquee kind of program that has really put Arkansas in a national spotlight. Latest private number options: 230,000 enrolled, 242,000 approved. Average monthly cost per recipient, $481 and some change, below the $500 per recipient threshold. Is this program working?
It's a good question. I mean, my answer to that would be that the private option is a good first step. And we wanted to take a step towards innovation, and the private option was a step towards innovation. I think that's a good thing. But more importantly, we want to move it further from what we have right now, and we want to see where we can go from the private option. I think the private option was a good first step from where we were as a state. But we certainly don't want to rest there. We want to keep pushing the pace and keep pushing innovation.
Right. You get a seat on the task force, but maybe not a vote on the task force. It's 16 legislators and you. So tell me what you think the mission of the task force will be. You're going to get started this next week and certainly ramp up in the weeks after that. But what direction, how do you think this locomotive is going to move?
Well, for the last few years, we've been talking solely about the private option. What the task force is looking at is all of healthcare reform. We're going to be looking at a lot of different topics. And, if you remember the governor's healthcare speech a few months ago, he showed a pie chart and showed that the private option was a sliver of the overall Medicaid pie. We're not going to be talking about that sliver exclusively anymore. We're going to be talking about the entire pie and how we can reform that. And the purpose of the task force is to get people with diverse perspectives all together, get everything out on the table, and to come up with the best ideas for our state to really impact healthcare reform in our state. I think this is a once-in-a-generational opportunity to do this, and if we do it right, we're going to positively impact the state's healthcare for generations.
I think one of the things the task force is going to look at, because I don't think they're going to rebrand the private option as you indicated. It's going to be bigger than that. It's going to encompass more than that. I think there'll be a wholesale look at changes through what a waiver known as the 1332 waiver. Just very quickly for our audience here, it would basically allow, I think this comes online in 2017, modification or elimination of the individual mandate, part of the Affordable Care Act. The employer mandate can be modified or eliminated. Benefits or subsidies can be modified, and you could modify or eliminate marketplaces or qualified health plans. How do you see this working? That's really pretty open-ended stuff right there.
Well, that's what makes it exciting. And the governor has been asked, isn't this a stall tactic? Isn't this a punt, so to speak, with the task force? But it's really not. I mean, when you look at the opportunity to truly remake Medicaid and remake healthcare in the state through these 1332 waivers, we've got an incredible opportunity. There's a lot of flexibility built in to the Affordable Care Act through the 1332 waivers, and states that are active in pursuing this could really come out with something that's innovative at the end of it. We're going to be looking at 1332s. We're going to be looking at how they can combine with the 1115 waivers. And hopefully at the end of all this, we're going to come up with a package that is well suited for our state and innovative, and can potentially, the ripple effect from this can potentially go into other states, and we can lead for the nation.
It will have to be approved by the feds, though,
Yes.
in order to do that. I think two of the things that seem problematic to me just at the very beginning of this are the individual mandate and the employer mandate. That is what has gotten so many people into
Right.
the healthcare system, into health insurance that didn't have it previously, so that we've seen those uninsured numbers fall as dramatically as they have. So if you take that hammer away, I mean, what's going to be the incentive to get people enrolled in those programs?
Well, that's a good question, and the answer to that is, no one really knows exactly what we're going to come up with at the end of all this. I'm sure there will be incentives. The encouraging thing, talking about what the federal government is allowing us to do, is, the first thing I did as Surgeon General with the governors, I flew to D.C. With the Secretary, and there was a lot of discussion back and forth about how much flexibility we were going to have. One of the comments that the Secretary made that's really stuck with me is, she said, if the White House policy is specifically against this, I can't give it to you. If the law is written in such a way that it says I can't give it, then I can't give it. But everything else is on the table for discussion. So I think the federal government is in a position where they're willing to negotiate, it seems like. And if we can come up with something that satisfies their goals, then I think that we'll end up with something that's really good for our state.
Could be a curveball thrown in the midst of all of this. This summer, the U.S. Supreme Court expected to issue a ruling in King versus Burwell regarding the constitutionality of the exchange insurance subsidies that are tied to the Affordable Care Act. If it's upheld, it's kind of business as usual.
Right.
You move on. If it's not, it's chaos, isn't it?
Well, it certainly is going to change the dynamic. And a lot of the people who are involved in this, who've been looking at it, have been wondering what exactly is going to happen, especially for states like ours. No one really knows. That's the truth of the matter. But the governor and I and the rest of the staff have been looking at how we would respond in case they ruled against the government, against Burwell. And we have a plan in place to deal with that, but we're not going to get out ahead and speculate until the Supreme Court actually makes its ruling.
So I don't get any details of what that plan may entail?
Unfortunately, not today, Roby.
All right. I'm warming up some FOI requests now as we speak. Do you think this task force can get its work done by the end of this year? And
I do.
will it require a special session to come in and make the changes?
I think the special session is definitely on the table. And regarding, do we think that we can accomplish something with the task force? Do we think that they can get their work done? Absolutely. I'm very optimistic. When you look at the leadership, Representative Collins and Senator Hendren are both experienced leaders. They're very involved and engaged on this issue. And you look at the makeup of the task force. Every one of the task force members I've met with and talked to, I really like them. They're intelligent people who care a lot about our state. And they're very interested in seeing the outcome of this be something positive. So I think we're going to come up with a good plan by the end of the year.
All right. He's Dr. Greg Bledsoe, Arkansas Surgeon General. Thank you so much for being with us, and it's
Thanks.
good to have you back.